Adult social care should be part of social guarantee for various reasons. So many of us do need or will eventually need support to maintain our independence, dignity and control. And like other essential public services, it's right that this should be free at the point of need. Unfortunately, with adult social care, particularly in England, the service is now broken. So we're seeing increasing numbers of people unable to access the care that they need for things like washing and dressing. And we're seeing social care providers at risk of collapse. The service currently is woefully underfunded due to years of funding cuts and austerity, rising demand, increased pressure on services, and a workforce that's essentially evaporating. The other problem is with ownership. So we've seen a huge shift from state to private ownership since the early 1980s. In some instances, this shift has led to the exploitation of the care sector by corporate giants and hedge funds. And so with a different kind of ownership structure, this is money that could otherwise be spent on improving care, as well as more supportive terms and conditions for low paid and undervalued staff. We need to be thinking much more about insourcing. So Halton in Merseyside have recently insourced a number of their nursing and residential care homes. It's also not just about state delivery and also about more interventionist and inventive commissioning. Areas like Newham have commissioned a dementia cafe from a local social enterprise. Wigan and also Newham have in effect introduced a system of social licensing where they've managed to restrict the home care market in their areas so that it's just local socially productive businesses who are paying the real living wage that are now delivering their home care. But in short, then, we need to reanimate the demand of decency for service users over dividends for shareholders. And we need to return to a system where the default position is the state delivery of services in conjunction, where appropriate, with alternative models of ownership like community businesses, like social enterprises and cooperatives.